Welcome to the Easy Conversations podcast. Thank you for joining me today, and thank you for going through all the effort of making it work. But yeah, I think there's a lot to uncover today, especially when it comes to your story and some of the challenges you encountered, especially with like life-threatening stuff. And it's always interesting to hear how people come back from that and how they're able to share that story, and then how then they're able to find meaning in their lives, which I think you have as well. So before we jump into all of that, I do want to give you an opportunity to introduce yourself to the listeners and if you're able to share what's brought you here today and who you are.
Sure. Thank you. My name is Michael Hession. I'm a physician. I'm a cardiologist. I graduated from Dartmouth Medical School. I did my internal medicine training at Boston University Medical Center, then University Hospital, and my cardiology training at Brigham Women's Hospital. I started practicing at South Shore Hospital in 1985, and I specialized mostly in patients with coronary disease, heart failure, arrhythmia. And somewhere along the line, after maybe 10 years or so, I started to do administrative work for my group and became the chief medical officer as the group grew, and split my time between seeing patients and being a chief medical officer.
Mm-hmm.
I was a pretty successful physician. I had a cumulative number of honors. My life was at its peak. And my kids were grown. They were out of school, had good jobs. And my wife and I were traveling and enjoying life. December of 2013, I came down with a cold. But the cold didn't really go away. It got worse. I was put on some antibiotics by my physician. Still didn't get better. Had an x-ray, should have had a pneumonia. But I didn't have a fever. My blood oxygen was good. So I said, just wait it out, finish the course of antibiotics. Except I continued to deteriorate. And on New Year's Eve, 2013, I awoke unable to breathe. My wife had already been woken up by my labored breathing. She called an ambulance. I was brought to the hospital that I'd worked at for over 35 years. And in the emergency room, I was pretty sick. My x-ray showed that the pneumonia had gone much worse. It had gone from one lobe to basically the entirety of both lungs, and that I was going to need life support. In the intensive care unit, I was placed on a ventilator. In my life, really, from that moment on, never was the same.
Mm. Yeah. Yeah. And are you able to speak about that experience? And then when you and I have chatted, you've talked about your near-death experiences as well. Are you able to shed light on what's changed since then? And then I obviously want to come back to your childhood too. But yeah, let's talk about what those experiences were like and how has your life changed since then?
I could tell you nothing in my life up to that point had prepared me for being a patient critically ill on life support.
Mm-hmm.
I couldn't talk because there was a tube down my throat, breathing tube. It's a very uncomfortable thing to have done, and I guess I was moving around a lot, so they gave me a medication called mercurium to essentially paralyze my movement. So I couldn't move. I couldn't see that well because I didn't have my glasses on. I could hear, and my hearing became acutely, it was the only sense I had, so it became acutely hyper aware of anything that was being said.
Mm-hmm.
My wife and my family were with me every day. I could hear them talking to me, talking to themselves. I could hear the physicians each morning talking at the foot of my bed. But other than my family, very few people spoke to me. It was very disorienting. I knew as a physician I was in very bad shape. My chances of survival were very poor. And it was the most distressing experience I could have imagined because both my lungs were in very bad shape. I had to be suctioned frequently. and involved placing a tube down inside the tube, going into your lungs, and essentially sucking out the debris in the air.
Mm-hmm.
I don't know if you've ever seen the movie The Mummy, but it's like when Imhotep inhales the air out of the grave robbers. It's a very unpleasant feeling. It left me drenched in sweat and just really very stressful. But it was a procedure that I had to endure, and I was, as a physician, always amazed at what some people could endure to survive. And I knew I had to endure this to survive. It happened multiple times a day. And after one episode, I remember not waking up the way I did previously. My body felt cold and very distant. I could hear crying in the background, mournful wailing. It's a Gaelic term called keening. The only time I'd ever heard it was the night my mother died when I was 13.
Mm-hmm.
It was a strange thing to hear that. It was a sound that meant death. And I couldn't really wrap my mind around why I was hearing it.
Mm.
And I felt my body drifting away, getting colder. I could hear the keening in the background. I looked and saw that the noise was coming from my wife, my sons, my brothers, and my sister. They were trying very hard to pull me back, but a force was much stronger pulling me away. And then after a while, I couldn't hear them or see them. I was just drifting. And surprisingly, the drifting was very peaceful.
Mm.
And I wasn't terrified the way I was earlier. And then I saw a white light, and I really didn't know what it was. And I kept being drawn closer to that white light. And the white light took on the image of a woman in a glowing gown, a glowing white gown. And she said something to me that I'll never forget. Michael, it is not your time. You must go back. And I began to drift back to my family.
Mm-hmm.
And the next thing I was aware of, my wife was talking into my ear and telling me, Michael, good news. The doctors have said you're responding to the treatment, you're getting better.
Mm.
And I didn't know whether I had hallucinated that or whether it was real. I'd read stories of people who come near death and talked about a white light. But I was ecstatic. I felt I was getting better. And surprisingly, from that point on, I didn't fear death. It was an almost rapturous feeling. Despite all of the horrible things that lay in store for me, I knew that I was going to survive. And in my book, I talk about that experience. And the memory of that experience stayed with me. And it wasn't until I was in rehab that a friend of mine brought in some gifts, books to read, and handed me a bag with, inside was a candle, and said that his daughter, who was a student at Notre Dame at the time, had asked that the students at Notre Dame pray for me, say the rosary for me. And it was then that I realized that wasn't a dream or a hallucination. It was in fact real, that somehow those prayers were heard.
Yeah.
And I knew, experience in my life, not all prayers were heard. The prayers I said from my mother to survive when I was a child, she didn't survive. So not all prayers are heard, but for some reason, those prayers were heard, and it wasn't my time to die.
Mm-hmm.
And I realized that somehow or another, I had to continue to get stronger.
Yeah.
When I was in rehabilitation, I was recovering from the pneumonia, the acute respiratory distress syndrome, or cytokine storm, as it's become known since COVID. But I had also been diagnosed with Guillain-Barré syndrome. I was paralyzed from the neck down. At first, they thought it was a prolonged use of the mesoparalytic, but it was in fact Guillain-Barré. And that was really pretty terrifying. I couldn't move. I couldn't even swallow. I had to be taught how to swallow, how to move my hands, how to do everything. And it was just a week before that I was struggling to learn how to breathe again. But I realized that I had to work hard at rebuilding my life, work with therapists. I've used my story. It's part memoir, part self-help book to help others who are going through critical medical illness and to show them how it's possible to recover from what would seem to be impossible.
Yeah. Yeah. No, I appreciate that. And that would have been my question. So I appreciate you explaining why you're also sharing your story. But it is interesting. So, as a physician who is trained in the scientific method, where often in science, it's hard to understand duality, how, and as you've said, you don't know for sure if you were hallucinating that time when you had that experience. But how do you make sense of it especially as a physician, that something like that could happen while you're stating that, yeah, you've heard other people experience it too, but how does one make sense of it when it happens to themselves?
It's very hard. I think we all use our past experiences as a guide to help process what occurs in life. But as a physician, I've seen all too often people that I thought were going to survive, not survive.
Mm.
Other people that I thought had very little chance of survival survive.
Mm.
And I've, in the course of my life, seen people pray very hard. Sometimes the prayers are heard, sometimes they're not. So it really can't be understood in the context of science, because there really is no scientific explanation for it. I think it has to be understood based on faith. And it doesn't matter what religion you are. I think most religions have a concept of an afterlife. And I think I would venture to say that what I saw was a glimpse of the afterlife. There was no sign that proclaimed what it was or announcement that this what it was. It was really just a feeling of inner peace, of tranquility, and almost rapture. And as I said, surprisingly, despite the horrors that awaited me, I didn't fear death. So there really is no scientific explanation, and it cannot be understood based on science. Really, it's faith. Either you have it or you don't have it.
Yeah, and I agree. And I think the other thing I'm hearing from you is that it doesn't have to be this scary place that we go to, right? There's so much fear around death because we don't understand what happens. But as you're sharing, and everyone's experience is obviously unique in that sense, and we still obviously don't know exactly what happens. But in that moment, as you're sharing, it felt peaceful and there was tranquility in it. Now, I do want to come back to the childhood side because a huge portion of your story revolves around the experience you had, as you shared, with your mom's passing from just breast cancer when you were fairly young. Are you able to talk about that and how that shaped you into even going into your profession? And how was that like to experience something at such a young age? And it's something you've obviously touched on here briefly, but I do want to get a deeper understanding of that experience.
Sure. It's a very emotional thing to discuss, but my mother was diagnosed with breast cancer when I was 9, and she had her first surgery in 1962. Cancer care in the 60s is primitive compared to what it is now. There was very little to offer other than surgery. And she had a radical mastectomy, which they don't perform anymore, but basically what that entailed is you remove the entire breast, all the tissue, all the muscle, right down to the ribs. Then you remove all the lymph nodes in the axilla. She had to have a skin graft to cover the area of her chest where the breast was removed, and her arms swelled. because there was no lymphatic drainage to prevent, so nothing prevented the fluid from accumulating. So her arm swelled tremendously. She was in a lot of pain. She recovered from it. And then 2 years later, she was diagnosed with breast cancer on the contralateral side. Again, the same thing.
Mm-hmm.
Radical mastectomy, skin grafts to cover that up, remove with all the lymph glands in the other armpit, and that arm swelled up to the point that almost made both arms useless.
Mm-hmm.
She recovered from the surgery, and about a year later, the cancer spread to her bones. And it was horrible. There was no treatment for it. When she was near death, they gave her morphine. But as I said, cancer care was pretty primitive back then.
Yeah.
There was no such thing as hospice or palliative care. And suffering was felt to be, I don't know, something you were supposed to bear.
Mm-hmm.
Pain control wasn't really a part of the ethos of treating patients back then. She suffered horribly. And in retrospect, I think it was then that I realized that as a physician, I could do a better job taking care of patients. And it, I think, inspired me in many ways to become a physician.
Mm-hmm.
It wasn't at that moment that I said, I'm going to be a doctor. I think
Right.
it really, it took a while to marinate and formulate what I was going to do with my life. Just getting through something like that was horrible. It was horrible on my father, horrible on me, horrible for my siblings. It was a very cruel thing.
Yeah.
And there wasn't much really that anybody did to help family members who survived something like that. And I believe I had, in retrospect, as well as my father and my sibling, PTSD related to that. Over the years, we worked through it and moved on with our lives. But I think that there's a lot more awareness of how critical medical illness and life traumas early on can really affect children as well as adults. So I learned a lot. And in the course of all of it I've been through, I really came away with a couple of insights. One is empathy and compassion are the two superpowers that anyone in healthcare, physician, nurse, or anyone for that matter in life can, if they master, they will be happier and they will make anyone they come in contact with happier. They will lead a fuller life and be better people for mastering that skill. The other insight was what I talk about in my book: acknowledge, accept, and adapt. I learned in caring for patients over the years that if a patient could acknowledge what they had, whether it be heart disease, diabetes, whatever illness it is, that they would have a chance at doing well. Getting stuck in denial prevents you from getting better. So if you could acknowledge what you have, accept it, not get angry about it, or enter in a state of denial. And finally, the third piece is accept and adapt. Knowledge, accept, and adapt. If you can do all three, you can survive any horror in life
Mm-hmm.
and have a life full of happiness, meaning, and purpose. I didn't come across this all on my own. Years of reading through school and when I was recovering helped me formulate that knowledge, accept, and adapt. But going back to Man's Search for Meaning by Viktor Frankl, he talked about that. And he was a prisoner at Auschwitz. He said, when asked who survived, he said, the people that lived in the past every day mourned what they lost. They withered and died.
Mm-hmm.
The people that were overwhelmed but the circumstances of their day-to-day existence didn't survive. The ones that survived were the ones that could look to the future and had hope of a better life. And Admiral Stockdale had a very similar, I think, comment when asked how he survived 8 years as a prisoner of war. Is the same thing. You know, the people who are the eternal optimists thinking they're going to be home by the holidays or whatever, they came and went and they withered and died. The people that were able to acknowledge the horror of the present, accept it, not become overwhelmed by it, endure it, and look forward to the future. Those are the ones who survived and came out physically and mentally intact.
Mm-hmm.
It's not that the torture was any easier or the solitary confinement was any easier, but they were able to process it in a way that Viktor Frankl talked about. And in my favorite Greek philosopher, Epictetus, Admiral Stockdale also enjoyed reading.
Yeah.
He really, thousands of years before, several thousand years ago, talked about it as well. So these are not new concepts, but over the years they've been rediscovered and talked about in the context of the individual circumstances, such as with Viktor Frankl and Admiral Stockdale. So how we behave or how we react to what's happening to us will determine how well we do, how we survive and recover.
Yes, absolutely. Yeah. And I appreciate you sharing all that insight, because you're right. A lot of these ideas have been around for millennia, and we're rediscovering them in different forms. So I do appreciate that. And the other thing, speaking of challenges and navigating them, it didn't stop there for you, because the other thing you've shared with me is your father was also diagnosed with cancer. And how was that experience after going through that agony with your mom, and then having later, obviously you were a bit older at that time, you were in med school, but how was it at that point?
It was hard. They didn't have hospice at that time or palliative care. And I went to see him in the hospital, and the doctor said, "Your father's dying. He can't stay here. You need to take him home." And I decided at that point, I took a leave of absence from medical school and cared for him at home. Got a hospital bed, oxygen, give him his medications. And he took care of us after my mother died and kept us together.
Mm-hmm.
Many of his friends had told him to put us in foster care, but he decided that was not what his wife, my mother, would have wanted, and somehow found a way to do it.
Mm.
He worked nights, so during the day we were on our own, went to school, came home, and then we learned as a family, each were given responsibilities of things to do. Chores, we divided it up amongst the four of us, and we became very close. And it was something I had to do, to take the time off from medical school, taking care of my father, giving him as good a death as possible was what I owed to him.
Mm-hmm.
It was the least that I could do. It was
Yeah.
very hard, but I did it, and eventually passed, mourned him, and then when I went back to medical school, that was actually good for me. I could take my mind off of all the suffering and the raw emotion of what we had just gone through, and the memory of what my mother went through. I could put that in the past and focus on what I needed to do at that time, which is finish medical school.
Yeah.
And I did.
Yeah, for sure. And I put out a newsletter this morning around this whole notion of us inheriting generational trauma from our parents. And sometimes we have this responsibility, if we are willing to take it on, to heal that, not only for ourselves, but to break the chain with us. Part of your story, as you've gone through this suffering early in life to lose both your parents, the other thing you had shared with me was being in the medical profession, that became your identity. and then going through your own health issues, have you been able to put it all together in terms of why did you go through your health issues? And did that allow you to look at your identity differently, especially having that near death experience, whether real or not, but even placing it in the sense of the experiences your parents had for you to be on the receiving end of it as a child? How have you been able to put all of that together for yourself?
It was a process, a journey. Being as sick as I was on life support, totally dependent upon machines to live, was very disorienting. It was terrifying. The moments when people took the time to talk to me, even though I wasn't able to communicate, were amazing. I had taken care of many patients intubated on life support. Can you say something briefly? But you don't spend a lot of time talking to them because they can't respond. You spend a lot of time talking to the other doctors and the nurses and the family members. But I have to say that the time that was taken by those who did speak to me, whether it was a phlebotomist, a nurse, or physician, even though I was unresponsive, I was aware and I could hear, I could process. And it was incredibly impactful to be treated as a sentient human being, even though you were basically like a piece of furniture in the room, unresponsive in the normal sense of a human existence. It was profound. And I never in my life would have thought it would have been so profound. And I remember reading a book called The Count of Monte Cristo. There's a character in the Monsieur Villefort who had a stroke, who left him in a state where he couldn't move, but he could move his eyes and he could hear, he could feel, he could understand. It's called locked-in syndrome. Basically, being intubated, paralyzed, unable to move, but able to see and to move my eyes, gave me an incredible insight into what it was like to be a patient.
Mm-hmm.
I was trained to be a physician. I was a good one, but I was never trained to be a patient. I don't think anything can really quite prepare you for that. But I learned a lot about what it's like to be a patient, and also from the perspective of a patient as a physician. And I talk about that in my book and how it's so important to just take the 60 seconds to touch the patient, to talk to them, let them know who you are, what's going on, is a very powerful thing that will help calm the inner turmoil that every patient feels when they're intubated and sedated or in a coma. And it really was, it changed me. And I also learned empathy.
Mm.
We just have a word in the dictionary, but I came out of this whole experience with a perspective on what it's like to be a physician who's a patient, how helpless it is to be a patient,
Mm-hmm.
to not know whether or not you're going to live or die. And so it taught me many skills. It also really taught me, as I said earlier, that empathy and compassion are the true superpowers
Yes.
that anybody can have. I think it's essential in physicians and nurses, but I think any human being, empathy and compassion are important skills to master.
Yeah.
It'll improve your relationship with your spouses, your family, your children, your friends. You'll be a better person for it.
Absolutely. Yeah. And how is that whole awareness now and experience shaped your identity from being a physician to who you are now? How do you look at yourself in terms of your identity?
I was unable to go back to practicing medicine the way I was before. Just it wasn't physically possible for me to cover the ICUs in the emergency rooms and to run back and forth. So I took care of patients in the office, and I started to really think about the lessons that I learned, and I refined this concept that I spoke of earlier of acknowledge, accept, and adapt as helping patients get through whatever illness they have. Most illnesses, there's a huge amount of denial when you're first diagnosed. You don't want to believe it's happening. Then there's anger, or sometimes people just ignore what's going on. They continue smoking, they continue to eat poorly, they have diabetes, they have high cholesterol, heart failure. It's the people who can really acknowledge their illness, accept it, not get angry about it, and adapt their lifestyle. Those people can survive and be happy. And I learned, as Epictetus said, and Viktor Frankl said, and Admiral Stockdale said in their writings, that everyone gets something. You don't get to pick what it is, but you do get to choose how you respond to that. And I refined those lessons into short messages I would share with my patients and to help them to overcome whatever it was and go through the shock and denial that everybody feels. And I think the whole experience of being sick, nearly dying, and the prolonged recovery with so many complications, it made me a better person. It made me a better physician. It made me a better husband. It made me a better father. And I look back on that and it's almost a gift. You know, as Admiral Stockdale said in his book, he said, was he angry about the 8 years of being a prisoner of war? He said, no, I wouldn't change it for anything. It was a defining period of my life that helped me to become a better person. And I think anybody in life, pretty much everybody in life, is going to experience something. And how they choose to navigate those events will determine the person they become in the future trajectory of their life, and also impact the people that they love and all the people around them. So I tried to share those lessons when speaking to my patients, and then I decided to write this book. In January of 2020, during the pandemic, I saw the horror that the world was experiencing. My son was a senior resident in New York, and pretty much his whole day was taking care of patients who were critically ill with COVID. Many of them died. And he talked about walking to work and seeing the refrigerated temporary morgues. And when he would walk home, there'd be more temporary refrigerated morgues, and how difficult it was for people and families to comprehend what was going on. And I thought I could share my personal experience with what it was like to have acute respiratory distress or cytokine storm, a prolonged and uncertain recovery, and use my story and the insights that I gained to help others. And that was the reason I wrote the book, and that's the reason why I'm doing public speaking and the podcasting.
Yeah.
I think the message is one that will resonate with a lot of people who are looking for answers of how to navigate the uncertain path of life.
Yes, absolutely. Yeah. And I agree. Going through what you went through with your parents and then going through what you went through with yourself, do you think there's an aspect of generational healing that's taken place?
Oh, yes, I do. As I said, my brothers and my sister were with me pretty much every day. One of my wife or my sons or my siblings would stay with me at all times. And I think for them, it was a reliving of traumas from death of our mother and then our father that they had to work through, and also seeing what I went through, I think helped them in many ways. And I think just as I had symptoms of PTSD from what I went through as a child and then from this illness, they did too. And we all learned to overcome it in our own ways, but also supported one another. And I think it's important. You never know how strong you can be until you're forced to be strong. And you never know how or what you can do to help support someone you love until you're put in a position where you have to. But I think there is definitely a generational healing. Nothing happens in a vacuum, and everyone is affected by it.
Yes.
And I think even some of my friends, and they were affected by it. And I think it was a process for them as well to experience seeing me as sick as I was and then the recovery and what it looked like and how long it took.
Yeah. Yeah, for sure. And are you able to speak to some of the awards you received as a physician and how that goes hand in hand with some of the things you've already shared in terms of the valuable lessons you've learned in your time, especially around the empathy and compassion being the superpower? Are you able to tie it together with the awards you were able to receive as well?
Sure. During my active years before this illness, I had been voted like a top doctor in cardiology by Boston Magazine. I had It's a fellow of the American College of Cardiology, fellow of the American College of Physicians, president of the Mass Medical Society, being awarded Physician of the Year. Following my illness, I think, to your point earlier, how my life affected not only myself and my family, but also many of the people who cared for me. The Social Hospital where I worked at had me come back and do a lot of Schwartz rounds, and named after Ken Schwartz, who died of lung cancer, and funded a foundation whose mission it was to encourage people to be mindful of the care they provide to patients who are very sick or dying. The least thing done with compassion makes those who are suffering feel better.
Mm-hmm.
And so I've given Schwartz rounds at Social Hospital, spoken to the medical staff, and they created an award in my name called the Michael J. Hession Compassionate Care Award, because they wanted to really take the lessons that I talked about in my book and to help inspire other doctors and nurses and student doctors and student nurses as well to really master compassion and empathy. There's a lot of stress in healthcare right now. Our emergency room and most emergency rooms in the country are constantly dealing with overcrowding. You can't get to see a primary care doctor if you're sick. You end up in the emergency room. So it's not unusual to have hours long waits, and people sometimes wait days to get a bed. So it's a pretty stressful working environment. You're coming into a situation where you're at 110, 120% of capacity. Every bed is taken up, and people are waiting hours, if not days, for a bed. And it's easy to become short tempered or curt. And they realized that this compassion and empathy is a superpower, was something that they wanted to foster an award and acknowledge with an award to anyone who demonstrate that. So the first award was given last month. I presented the first award. It was to an emergency room nurse. It was during the night shift, and as usual, every bed was taken up, every inch of hall space was taken up with stretchers. And the young man who was given the award was quite busy, but there was one woman who was very tearful and crying, "Where's my daughter? Where's my daughter?" He would take the time to sit, hold her hand, talk to her, and said, "She's at home right now, but she's busy taking care of things. She'll be coming to see you as soon as she can."
Mm-hmm.
And this happened every 20 or 30 minutes. And the nurse never lost patience, even though he was busy doing other things. And this family member of another patient who was there was so impressed with the compassion, empathy that this nurse showed to a patient who wasn't even someone he was taking care of,
Yeah.
but it was just someone in need. But it demonstrated the power, the superpower of compassion and empathy, how it not only calmed that patient, but also impressed this woman and the woman's mother, who was also in the hallway.
Mm-hmm.
So I think that the message and what I've talked about is living on and will live on with this award. And I think medication today is complex. Taking care of people is complex. The system is under intense strain. And it's very easy, I think, for those providing healthcare, the physicians, the nurses, anyone, to become overwhelmed with the needs and the demands, and they lose sight of the humanity and the power you have to help other people in very simple ways, just by holding someone's hand, taking 60 seconds to show empathy and compassion can go a long way towards soothing the terror that most people feel in a situation they have no control of.
Mm-hmm. Yeah. Yeah. No, I agree with you. And it's such a powerful message. I guess now where you're at, like what's next for you? Where do you see things going from here, considering everything you've been able to accomplish and go through personally as well, and some of the wisdom you've been able to pass along to, especially in the medical profession? Where do you see things going from here for yourself?
I've been very much impressed by the difference that I can make in with my writing and my speaking. And I have become very active speaking at the Mass Medical Society, hospital medical staffs, to libraries, community groups, different messages depending upon the audience, but also in writing. And I started another book, Dealing with Pain. Part of my journey through this whole thing was living with pain, the pain of being intubated, the pain of I had from my herniated disc in my back, from my hips. Eventually, I had my hips replaced. And how you deal with pain. I think that my first experience with pain was with my mother when she was dying from metastatic breast cancer to the bone, and how insensitive people were to her pain. There wasn't any concept of pain control in cancer patients back in the 60s. And then I think in the 90s and beyond, there became a movement that we needed to do something about pain. And the drug companies really formed that discussion. And they created more powerful medications, highly addictive medications, and convinced people they needed to be on these medications and convinced doctors they needed to put their patients on medicines. And it really wasn't the right thing to do. It just created another problem. And so in the book I'm working on, it's the journey of understanding pain and how you approach it. And it's not approaching it with a nail with a hammer. There are better ways to treat chronic pain. And I talk about that.
Okay. No, that's great. I'm looking forward to seeing more of your work coming out. But Michael, thank you for this enlightening conversation. I know there's still a lot of emotion and pain behind talking about what your parents went through and you witnessing that firsthand. So I appreciate your vulnerability, even though it's part of your story. And it means a lot for you to come on here and share all of that. And thank you for sharing your personal experience as well and how you've been able to come out of it. Now, for listeners that want to learn more about your work or your writings, especially your book that's already been published, what are some ways they can find all of that online?
The book is available online at Amazon or Barnes and Noble. The title of the book is Physician, Heal Thyself, Nearly Dead in the Journey Back to Health. My website is listed on there. It's www.acknowledgeacceptandadapt.com. They can send me messages. I've been making myself available to do Zoom book clubs all over the country. I have a set of talking points questions to ask, book club questions. But they can send me individual direct messages. They can view my website, which tells a little about my story. And I think more importantly, I think the book is a really powerful. I made it so that it's very readable. It's not exceptionally long. I put lots of bibliography notes if people want to delve into things in more detail. But I think it will help pretty much anybody who is going through something or knows someone who's going through a stressful life event, help them navigate it. It's part memoir, part self-help. But when I was recovering and looking for some advice on how to navigate the recovery phase, there wasn't a lot out there. I think people are now realizing that there needs to be more attention spent on helping people navigate the recovery phase of any illness or even an active illness like cancer. What does it look like? How do you navigate it? Those programs are now just starting up, but they're very much in the infancy stage. And there really was no book that spoke to what I felt needed to be shared on how you help someone navigate a critical medical illness or someone you love navigate a critical medical illness in the recovery.
Yeah. Yeah, for sure. No, we'll put all of that in the show notes. But Michael, thank you again for this conversation. Very much appreciated.
Thank you much for the opportunity to be a guest. I appreciate it.